Today we'll hear the stories of individuals who have dedicated their lives to serving others through providing direct services and supports, through program leadership and supervision, through building best practices and evaluating those practices, and for working in our administration and finance teams. They are honorable, they are compassionate, and they're living their lives in such a way as to make a difference.
In terms of looking at the awardees this year, like the ABH membership, it's more than the sum of their parts. Really our field coming together, working together to better meet the needs of individuals, to offer hope, recovery, resiliency for individuals that we serve. And when I look at the ABH membership, that's what I see. All of us collectively working together to make things better.
I sit down with so many providers and hospitals where they talk to me about how behavioral health and mental health especially is a loss for them to provide. And it is our job in the State House and across the Commonwealth to change that narrative. There is nothing losing about taking care of people with behavioral health.
We're putting about $10 million into the ESP system, but only with very clear goals that we're looking to achieve on that, and to be pretty directive about, both on the hospital side and the overall system side, what we are looking to see in an actual system of crisis care.
I've always felt that public health, we have a particular obligation to ensure that we address the needs of people in vulnerable situations, and many times are unable to advocate for themselves. We know that many of the priority populations that we serve at BSAS, which are pregnant and parenting women, recently incarcerated, men of color, and the dually diagnosed folks with mental health and substance use issues, are our priority, and we need to ensure that they receive better and more integrated care. Those efforts start with you and our service providers. You are the unsung people doing the hero's work on the front lines day in and day out, ensuring that those who are often unable to speak for themselves adequately have a voice, have a chance, and have a pathway.
This is what describes you, all of you who are being honored here today. You refuse to accept the status quo. You apply your passion to finding better ways to reach all of the individuals who are so in need of excellent behavioral health. You reach out for partnerships to do your work. We thank you, not just today when you're being specially honored, but each and every day. Because here's what you show us. You show us that treatment can work, that healing can happen, and perhaps the greatest contribution we can all bring is to continue applying the art of the possible.
So congratulations on your achievements. Thank you all for your commitment in supporting recovery, resilience, and empowerment for individuals with behavioral health conditions. I'm happy to be here with you.
Annie began her first tenure at UInc in 2004. While completing her master's degree at Smith College, Annie quickly made a name for herself as a gifted social worker. While being a lecturer at the prestigious Boston University School of Social Work, she simultaneously managed and directed all administrative and clinical services at UInc's Worcester offices. In the years since, she has risen further through the ranks, now serving as UInc's Chief Operating Officer. Under Annie's leadership, she has positioned the agency to increase access to providers with language and/or cultural competencies to meet clients' needs, improved integration and collaboration between mental health, substance abuse, and primary care providers, eliminated financial losses related to billing and operational inefficiencies, and alleviated burnout in clinical and direct care providers. I'm tired just saying all of that stuff. That's just a lot. You must be tired. Annie has broad clinical and program management expertise. This, coupled with her dedication to creating and supporting a workplace culture of compassion, collaboration, innovation, and effectiveness. As a result, Annie has been instrumental in a number of our major operational strategies and projects that have had significant positive impact on the agency. Annie's leadership has enabled U Inc. to more effectively integrate and align our behavioral health services in order to improve client experience and outcomes and maximize efficiencies. Annie is a vital member of the agency's executive leadership team and is responsible for management of 90% of the agency's budget, with oversight of more than 500 administrative and clinical staff. As Chief Operating Officer, Annie is responsible for overseeing all behavioral health and residential services and providing care to more than 12,000 children, adolescents, and their families that we serve each year. I am honored to present the Excellence in Administration and Finance Award to Annie Fine.
What Annie really knows is that nothing happens without a team. And so you're all part of our large team of people committed to caring about the people in the Commonwealth who are suffering, children and families who need our help. So thank you, Paula, very much for those kind words. And thank you to everybody at U Inc. who's a part of my team. Thank you, ABH, for taking this time to recognize the hard work that everybody does. And thank you for making the time out of your busy days to be here today. I woke up this morning and thought, oh goodness, I don't have time to go to ABH this morning. So I also want to say it's a special honor to get an award for administration and finance. Catherine Canada, thank you for your words about Brexit and what pulls finance and administration together with direct care staff, with social workers, and the unity of all of us providing this work. I think that without financial stability in the mass health system, in nonprofit organizations, financial stability for individual providers, for Commissioner McCullough's son, for the thousands of direct care people doing this work every day. Without financial stability, we have our own Brexit that'll become, is Frexit. That's when people leave the field because they can't afford to do the work. And I am so excited to be a part of the work that is happening with all of us integrating to look at the laws and the mass health reform and the whatever it will be named, BH reform process. And with that, we can move from Frexit to Fixit, and it's critical that we do that. So thank you all for the hard work in that effort. As Paula said, I'm a social worker by training, I don't have my MBA or CPA, which Paula does have. I'm also an English major in undergraduate training, and so to come back to Diane, you had a literary start to the day, and I want to say, and Mary Oliver in her poem Summer Day says to us all, tell me, what do you plan to do with your one wild and precious life? And for me, I didn't think as an English major that my wild and precious life would dig me deep into understanding UFR codes and the myriad functions of Excel, which I love, ADP, and all the ways I can analyze what staff are doing.
Those are things I wanted to do with my precious life.
Right. What I want to do with my precious life, with our precious lives, is to be part of the community of care. And the most meaningful circle of humankind sits right here next to me, with me right now. All of you who are committed to the well-being of one another, and that we look and care for one another. And whether we're doing it from administration and finance or direct care, that's what I commit to. So thank you very much.